Today we will be performing a wet to dry dressing change and hand hygiene. Going to perform hand hygiene while I gather my equipment, which is a pair of clean gloves, goggles, tape, the dressing change tray, a bottle of saline solution, and a pair of sterile gloves. Going to perform hand hygiene again. The patient's name is Jaguar J. Jones. The medical report number is 417-6352, and the patient is allergic to penicillin. Today we will be performing a wet to dry dressing change on the wound. I'm going to perform hand hygiene again. Then I will position the patient. I will raise the bed, lower the guardrail, and put the patient on his side. Going to put on a pair of clean gloves. And my goggles. I'll now remove the tape around the wound. Feeling towards the wound. And I will observe the drainage, the type, the amount, the color, the consistency, and if there's any odor. Remove the dry and the wet, noting the size of the wound, then palpate around, observing for any redness, edema, and the patient notes no tenderness. So now dispose. Perform hand hygiene again before I open the kit. And prepare the sterile feed. And I will dump out the contents. Then I will check the expiration date on the saline solution, which is January of 2021, and pour into the basin. I will now perform hand hygiene before I don my sterile gloves. I will then organize the supplies, making sure to stay within the 1-inch border. And I'll take 5 of the 4x4s and put them into the saline solution, avoiding the edge. I will assess the suture wound, noting its approximate length, which is about 6 inches long, and that the wound is sutured shut. There is no drainage, and I will now clean the suture wound by taking one of the 4x4s, squeezing out the saline solution, making sure to avoid the sterile field before going down the middle of the suture wound, disposing, grabbing a second 4x4, again squeezing to drain, avoiding the sterile field, cleaning the right side, disposing, a third 4x4, to screen the left side, disposing, and then grabbing a dry 4x4 to pat dry, and disposing. So now take the remaining 2 4x4s that were soaking in the saline solution, squeeze them out, and then fluff them, avoiding the sterile field and placing them into the wound. Again, squeezing, and then fluffing, avoiding the sterile field and placing into the wound. I'll take the last remaining dry 4x4 and put over top, and then the ABD pad with the line facing up and down, the same as the suture wound. I will now take off my sterile gloves and dispose of them, perform hand hygiene, and then proceed to tape the wound. Being sure to tape away from myself. Then on a piece of tape, I will write my name, the date, time, and then initial. I will now reposition the patient for comfort, lower the bed to its lowest setting, raise the guardrail back, and then perform hand hygiene before I dispose of supplies. And I will now leave to the nurse's station where I will document the assessment of the suture wound, the wound itself, and the patient's response to care.